When you think heart problems, what do you picture? Probably chest pain, getting out of breath, maybe someone collapsing on the floor like you see in movies. And yeah, those can be signs. But listen up, because here's the real deal. Heart damage doesn't always shout at you, it can be sneaky. Actually, some of the very first signs of heart trouble, they're so quiet, so easy to miss, that most people just ignore them. Lots of folks think, heart disease, that's just for old people, or only if you eat junk food and never exercise. Vibrant Seniors is here to tell you straight up, that's just plain wrong. It's not true. You could be feeling totally fine, walking around doing your thing, but guess what? Silent inflammation, just everyday stress, even not taking care of your teeth and gums can be slowly hurting your heart right now. And here's the scary part. When those big, obvious symptoms finally show up, the damage to your heart might already be pretty bad. That's exactly why knowing these 11 unusual signs, knowing them early, is so important. It could be the thing that makes all the difference. It could be what helps you catch heart problems when you can still do something about it, instead of waiting until it's too late and facing some really serious stuff later on. So stick with Vibrant Seniors, okay? Because today, we're going to lay it all out for you. We're going to show you the surprising symptoms, the ones you probably wouldn't even think are related to your heart, symptoms that could mean your heart is in trouble. And we're going to tell you what you can do to protect it before it's too late. Don't go anywhere, Vibrant Seniors, this is vital info. All right, number 1 on our list of surprising heart signs, calf swelling or pain. Think about this for a minute. Have you ever been walking around, maybe doing your errands or just going up and down the stairs at home, and you notice your calves are feeling kinda sore? Maybe they start to cramp up, feel really tight, or even start to swell up, especially if you've been on your feet for a while. It's easy to just think, oh, it's just age, or maybe I'm dehydrated, need to drink more water, or I probably just did too much today. You might just brush it off, think it's nothing serious. But Vibrant Seniors wants you to ask yourself, what if it's actually a warning sign? What if it's your body trying to tell you something important about your heart? What if it's actually a sign of something much, much more serious going on? Well, it could be a symptom of peripheral artery disease, or we call it PAD for short. PAD is a condition. It's when your arteries, the blood vessels that carry blood to your legs, get narrowed or even blocked. And the reason they get blocked, it's because of plaque buildup. That's that stuff called atherosclerosis. Plaque is like gunk that builds up inside your arteries. Think of it like pipes getting clogged. When blood flow to your legs gets restricted, when it can't get through those narrowed arteries, your muscles down in your calves don't get enough oxygen. Oxygen is what muscles need to work right. And when they don't get enough oxygen, they start to complain. That's when you get that discomfort, that pain, that swelling in your calves. It might just feel like a leg problem, just a circulation issue in your legs. But Vibrant Seniors wants you to know this. PAD is strongly, really strongly, linked to heart disease and strokes. It's not just a leg thing. It means your heart could be at risk too. If you have PAD in your legs, you could have problems in the arteries around your heart as well. And listen to this, Vibrant Seniors. Ignoring this symptom, just hoping it goes away, just thinking it's nothing, that can lead to some serious trouble. It could lead to more severe complications. That includes a higher risk of heart attacks and even strokes. And in really bad cases, if PAD gets really, really bad and you don't do anything about it, it can even lead to limb amputations. That's extreme, but it can happen. But here's the good news, and Vibrant Seniors always wants to bring you good news. There's a lot you can do. There's a lot you can do to improve your circulation, to get your blood flowing better, and to protect your heart. Simple things, but they make a huge difference. Regular exercise, even just walking every day helps a lot. A heart-healthy diet, eating the right foods, cutting out the bad stuff. And quitting smoking. If you smoke, quitting is one of the best things you can do for your heart and your arteries. These things can all help keep your arteries clear, keep the blood flowing, and protect your heart. So, Vibrant Seniors, If you're noticing that persistent calf pain or swelling, especially after you've been active, please don't just ignore it. Don't wait and see. Talk to your doctor. Get it checked out. Catching PAD early, finding out if that's what it is, that can make all the difference. It can make a big difference in protecting your heart and your overall health for years to come. Okay, number 2 on our list, bleeding gums and gum disease. Think about your teeth and gums for a second. You might think bleeding gums are just a little dental problem. Maybe you brushed too hard this morning. Maybe you forgot to floss for a few days. It happens to everyone, right? You might just think it's a minor issue, nothing to really worry about. But vibrant seniors, did you know that your gum health, the health of your mouth, is actually directly linked to your heart health? It's a surprising connection, but it's a real connection. Your mouth and your heart are more connected than you might think. Gum disease, the medical name is periodontitis, is more than just bleeding gums. It's actually a chronic inflammatory condition. Inflammation is when your body's immune system is in overdrive, reacting to something. And in gum disease, it's a long-term inflammation in your gums. And this inflammation, it allows bacteria to enter your bloodstream. Your mouth is full of bacteria, but usually they stay in your mouth. But with gum disease, those bacteria can get into your blood. Once they're in your bloodstream, these bacteria can travel around your body. And guess what? These bacteria can contribute to plaque buildup in your arteries. Remember plaque, that gunk that blocks arteries? The same plaque we talked about with PAD. These bacteria from your mouth can make that plaque worse, increasing your risk of heart disease and strokes. Inflammation is a big deal here. Inflammation is a key player in both gum disease and cardiovascular disease, which is heart disease and blood vessel disease. And research, real scientific studies, show this very clearly. Research shows that people with poor oral health, people with gum disease, are more likely to develop serious heart problems. It's not just about your teeth looking good, it's about protecting your heart from serious problems. So, how can you protect yourself, vibrant seniors? How can you keep your gums healthy and protect your heart at the same time? It starts with the basics. Good oral hygiene. Brush your teeth and floss. Brush and floss daily, every day. That's the best way to remove bacteria from your mouth before it has a chance to cause damage to your gums and get into your bloodstream. Regular dental checkups are also super important. See your dentist regularly. Your dentist can catch gum disease early, even before you notice any big problems yourself. They can catch it early before it leads to bigger issues, before it starts affecting your heart. But vibrant seniors, oral care isn't just about brushing and flossing. It's not just about what you do with your toothbrush. Your diet matters too, and your stress levels matter. Eating anti-inflammatory foods, foods that help reduce inflammation in your body that can help. Things like fruits, vegetables, healthy fats. And managing stress, finding ways to relax and lower your stress, that can also help reduce the impact of gum disease on your overall health, including your heart health. So, vibrant seniors, if you have red gums, swollen gums, or gums that bleed easily, don't just ignore them. Don't just think it's nothing. Your mouth might be trying to tell you something important. Your mouth might be sending a signal, and your heart is listening to that signal. Pay attention to your gums, take care of your mouth, and you'll be taking care of your heart at the same time. Number 3 on our list of surprising heart signs, snoring or sleep apnea. Think about snoring. Maybe you snore, maybe your partner snores. Loud snoring at night, it might just seem like an annoying habit, something you just live with. But vibrant seniors, persistent snoring, especially if it's loud snoring and especially if it's accompanied by breathing pauses, pauses where you stop breathing for a bit in your sleep, that could be a sign of sleep apnea. And sleep apnea is not just about snoring. It's a serious condition. It doesn't just mess up your sleep, it also puts a lot of strain on your heart. Sleep apnea happens when your airway, the tube that air goes through to get to your lungs, becomes partially or fully blocked during sleep. Imagine trying to breathe through a straw while you're sleeping. That's kind of what it's like with sleep apnea. This blockage causes repeated interruptions in your breathing, all night long. Each time you have a pause in breathing, each time you stop breathing for a few seconds, your oxygen levels drop. The amount of oxygen in your blood goes down. And when that happens, your heart has to work harder. Your heart has to pump harder to try to get oxygen to your body, and your blood pressure goes up. Over time, this cycle, this repeated pattern of oxygen deprivation, not getting enough oxygen and stress on your heart, can lead to some serious problems. It can lead to high blood pressure, which is bad for your heart. It can lead to irregular heartbeats, where your heart doesn't beat normally. It can lead to heart disease itself, and it can even lead to stroke, which damages your brain. Sleep apnea is not just a sleep problem, it's a heart problem too. People with sleep apnea often feel really tired during the daytime. They might get morning headaches. They might have difficulty concentrating, can't focus on things, and they often have frequent nighttime awakenings, waking up a lot during the night. But here's the thing, vibrant seniors. Many people have sleep apnea and they don't even know it. They just think they are tired, or they just think they snore. If you suspect you have sleep apnea, if you snore loudly, if you're always tired, it's crucial to consult a sleep specialist. Go see a doctor who specializes in sleep problems. They can evaluate you, they can do tests to see if you have sleep apnea. If you do have sleep apnea, there are treatments that can really help. A CPAP machine, for example. It's a machine you wear while you sleep, and it keeps your airway open. It makes sure you keep breathing normally all night. That can dramatically improve your symptoms, make you feel less tired, and protect your heart. And maintaining a healthy weight can also help. Being overweight can make sleep apnea worse. So losing weight, if you need to, can reduce the severity of the condition. Ignoring sleep apnea, just pretending it's not there, doesn't just lead to poor sleep, to being tired all the time. It can put your heart at serious risk. It's not something to ignore. If you snore loudly, if your partner says you stop breathing at night, or if you struggle with fatigue all the time, don't wait. Get checked out today. Take care of your sleep, and you'll be taking care of your heart, vibrant seniors. Number 4 on our list of surprising heart signs, sudden extreme weakness. This one's important, so listen up, vibrant seniors. We all get tired sometimes. Life is busy, we do a lot, we might not sleep great every night. Feeling tired now and then is just normal. But what we're talking about here is not just regular tiredness. What if you suddenly feel this overwhelming weakness, like it just hits you out of nowhere? Not just feeling a little sleepy, but extreme weakness, like you've lost all your energy all of a sudden. Not just regular fatigue, but an intense exhaustion. So tired that even simple tasks, things you normally do without even thinking about it, suddenly feel impossible, like trying to lift a heavy weight when you have no strength left. Vibrant seniors, this kind of sudden, extreme weakness. It could be a serious warning sign coming from your heart. Your heart might be trying to tell you something is really wrong. When your heart isn't pumping blood effectively, when it's not doing its job like it should, what happens? Well, oxygen levels in your body drop. Your heart's job is to pump blood, and blood carries oxygen to all your muscles and organs. Oxygen is what keeps everything working. It's like fuel for your body. If your heart isn't pumping well, less oxygen gets to your muscles and organs. And when your muscles and organs don't get enough oxygen, they start to struggle. They can't function properly. This struggle, this lack of oxygen, can lead to sudden extreme weakness. It can make you feel incredibly weak all of a sudden. This sudden extreme weakness is often accompanied by other things too. You might get shortness of breath, feeling like you can't catch your breath, or chest discomfort, maybe a tightness or pressure in your chest. Many people, when they feel this kind of sudden weakness, they just dismiss it. They brush it off. Oh, I'm just overworked, they might say. I'm probably just dehydrated, need to drink more. They think it's just from being too busy or not drinking enough water. But vibrant seniors, in reality, this sudden extreme weakness could actually be signaling something much more serious going on with your heart. It could be a sign of an impending heart attack. It could be your heart telling you it's in real trouble, right now. And listen to this carefully, vibrant seniors. This kind of weakness is different from regular tiredness. It's not like feeling tired after a long day. This kind of weakness comes on suddenly, out of the blue, and it doesn't get better with rest. You can sit down, you can try to relax, but the weakness doesn't go away. It's persistent. It can feel like you've just hit a wall, like you've run out of gas completely, even when you're doing something really easy, something that normally wouldn't tire you out at all. If you experience this kind of sudden extreme weakness, and especially if it's happening alongside chest pain, dizziness, or nausea, feeling sick to your stomach, don't wait around. Don't try to figure it out yourself. Don't think it will just pass. Call emergency services immediately. Call 911 or your local emergency number. Get medical help right away. Acting fast, getting help quickly could literally save your life in this situation. Time is really important when it comes to heart problems. Your body is smart. Your body knows when something is seriously wrong. It sends you signals. It sends you warning signs. Sudden, unexplained weakness like this, extreme weakness that comes on suddenly, it's never normal. It's not just something to ignore or brush off. If it happens to you, vibrant seniors, take it seriously, really seriously. And seek medical help right away. Don't hesitate, don't delay. It's always better to be safe, especially when it comes to your heart. It's always better to get checked out and find out it's nothing serious than to ignore a real warning sign and have something bad happen. Listen to your body. Sudden extreme weakness is a signal you should never ignore. Number 5 on our list of surprising heart signs, skin rashes or unusual spots. Now, this one might seem really strange. Skin problems and heart problems, do they really have anything to do with each other? Vibrant seniors, the answer might surprise you. When we think about heart health, we usually think about our chest, our breathing, maybe our energy levels. We rarely, if ever, think about our skin. Our skin seems like it's just on the outside, protecting us from the world. But did you know that chronic skin conditions, skin problems that last a long time, things like psoriasis or eczema, could actually be linked to heart disease? It might seem weird, but there's a connection. Both of these skin conditions, psoriasis and eczema, they are caused by inflammation. Inflammation is when your body's immune system is overactive, causing redness, swelling, and irritation. And guess what? Inflammation is not just bad for your skin. Inflammation also plays a major role in the development of atherosclerosis. Remember atherosclerosis? That's that hardening and narrowing of arteries due to plaque buildup. Inflammation is a key part of that plaque buildup process. So, people who have psoriasis, they are at a higher risk of heart attacks and strokes. Why? Because their bodies are constantly in a chronic state of inflammation. Their immune system is always turned up too high, and this chronic inflammation, this long-term inflammation, doesn't just affect their skin. It can affect other parts of their body too, including their heart and blood vessels. It can damage their arteries and increase their risk of heart problems. It's all connected through inflammation. So, vibrant seniors, if you've been dealing with persistent skin rashes, rashes that just won't go away, red patches on your skin, or scaly skin, especially if they don't seem to get better with regular treatments, with creams or lotions, it might be worth considering the bigger picture. Think about your overall health, not just your skin. While these skin issues may start on the surface, on your skin, they could actually be indicating underlying cardiovascular problems. They could be a sign that there's inflammation going on inside your body that's affecting both your skin and your heart. What's the best course of action if you're dealing with skin rashes that just won't quit? Vibrant Seniors recommends this. See both a dermatologist and a cardiologist. A dermatologist is a skin doctor. They can help you with your skin condition. A cardiologist is a heart doctor. They can check your heart health. Seeing both kinds of doctors can give you a complete picture. Managing inflammation is key here. Managing inflammation through a healthy diet. Eating anti-inflammatory foods, stress reduction, finding ways to lower your stress levels, and proper medical care following your doctor's advice. These things can all help protect both your skin and your heart. Your body is amazing, Vibrant Seniors. Your body often sends subtle signals when something isn't right. It's up to you to pay attention to those signals, to listen to what your body is trying to tell you. So, don't ignore what your skin is trying to tell you. Those persistent rashes or unusual spots might be more than just skin deep. They might be a clue about your heart health. Number 6 on our list of surprising heart signs: unexplained nausea or indigestion, stomach problems and heart problems. Another surprising connection for vibrant seniors to know about. We've all had an upset stomach at some point. It's just part of life. Maybe it's from something we ate, food poisoning. Maybe it's from stress, getting nervous about something. Or maybe it's just a minor digestive issue, a little bug. But what if that persistent nausea, that feeling sick to your stomach, or bloating, feeling full and uncomfortable, or stomach pain that just won't go away, isn't actually coming from your stomach at all? What if it's not a stomach problem? What if it's actually a warning sign, a subtle signal coming from your heart? It's possible, vibrant seniors, when the heart struggles to pump blood efficiently, when it's not pumping blood as well as it should, it can affect other parts of your body, including the digestive system. Your digestive system, your stomach, your intestines, they need good blood flow to work right too. If the heart is weak and not pumping well, it can affect the digestive system, leading to symptoms that mimic acid reflux, that burning feeling in your chest, indigestion, feeling bloated and uncomfortable after eating, or even food poisoning, feeling really sick to your stomach. Many people, and this is especially true for women, experience nausea and stomach discomfort as one of the very first signs of a heart attack. Yes, a heart attack can feel like stomach trouble because it doesn't always come with chest pain, the classic heart attack symptom. It's often dismissed. People think, oh, it's just indigestion, or it's just a stomach bug. It's something minor, nothing to worry about, until it's too late, until the heart attack gets worse and becomes a serious emergency. So, vibrant seniors, if your nausea feels unusual, if it's not like your normal upset stomach, if it lasts longer than you'd expect, or if it's accompanied by other symptoms, pay attention. If it comes with dizziness, feeling lightheaded or faint, shortness of breath, feeling like you can't breathe easily, or discomfort in the chest, jaw, or back, any kind of unusual pain or pressure in those areas, don't ignore it. Don't just wait and see. This could be your body signaling an emergency. This could be your heart screaming for help, but in a quiet way that's easy to miss. Call for medical help immediately. Call 911 or your local emergency number. Get checked out right away. Don't take any chances when it comes to your heart. Your stomach might not be the problem at all. Your heart might be the real culprit behind that nausea or indigestion. Trust your instincts, vibrant seniors. If something feels off, if something feels different than your usual stomach issues, it's always better to be safe than sorry. It's always better to get it checked out and find out it's nothing serious than to ignore a heart problem and regret it later. Listen to your gut and listen to your heart. Number 7 on our list of surprising heart signs: persistent hoarseness or chronic cough. A cough and a hoarse voice. Sounds like a cold, right? Or maybe allergies. But vibrant seniors, it could be more than that. It could be a heart sign, a lingering cough, a cough that just won't go away, or persistent hoarseness, a raspy voice that sticks around. These are often blamed on simple things. Allergies acting up, catching a cold, acid reflux, stomach acid coming up and irritating your throat. These are common causes. But what if it's something more serious? What if it's not just allergies or a cold? If you have a chronic cough, a cough that just won't quit, that hangs on for weeks and weeks, your heart could be the underlying cause. Your heart might be the reason for that cough. When the heart isn't pumping efficiently, when it's weak and not pumping blood like it should, fluid can build up in the lungs. Your heart's job is to pump blood, and that blood flows through your lungs to pick up oxygen. If the heart is weak, blood can back up, and fluid can leak into your lungs. This fluid buildup in the lungs, it can lead to a persistent, unexplained cough or hoarseness. This is often a sign of congestive heart failure. Congestive heart failure is a serious condition. It's when the heart is weak and struggles to circulate blood properly throughout the body. And this fluid accumulation in the lungs is a common symptom of heart failure. Many people, when they get a cough or hoarseness, they just dismiss these symptoms. They think it's just a cold or allergies or something minor, not realizing that a weak or failing heart can actually mimic respiratory issues, can feel like lung problems. But listen to this, vibrant seniors, there's a difference between a normal cough and a heart-related cough. Unlike a normal cough from a cold, a heart-related cough is usually dry. It doesn't bring up much mucus, and it's persistent. It just keeps going and going. It may also worsen at night or when you're lying down. When you lie down, fluid can shift and build up more in your lungs, making the cough worse. If you experience hoarseness, a raspy voice, or frequent coughing, especially if it's dry and persistent, and especially if it's alongside other symptoms, pay attention. If it comes with swelling in the legs, that could be fluid buildup too. Fatigue, feeling really tired all the time. Or shortness of breath, feeling winded easily. These combinations of symptoms, especially with a persistent cough or hoarseness, it's time to see a doctor. Get it checked out. Early detection is crucial. Finding heart problems early makes a big difference in how well they can be treated. If your cough doesn't seem linked to a cold or allergies, if it's not getting better, don't ignore it, vibrant seniors. Don't just wait and see. Your heart could be trying to tell you something really important. That persistent cough or hoarseness might be a subtle signal from your heart asking for help. Listen to your body and get it checked out by a doctor. Number 8 on our list of surprising heart signs, fainting spells. The medical term for fainting is syncope, but we'll just call them fainting spells. This one can be a little scary, so vibrant seniors, pay close attention. Fainting can seem like no big deal sometimes. You might think, oh, I just stood up too fast, or I skipped breakfast, my blood sugar is low. Fainting can seem harmless, like just a minor thing that happens every now and then. But sudden, unexplained fainting, fainting that you can't explain, or dizziness that leads to fainting, could actually be a serious warning sign coming straight from your heart. It's not always just nothing. It could be something important about your heart. Your brain, your amazing brain, it needs a steady flow of oxygen-rich blood to function right. Your brain is like a supercomputer, and it needs fuel to work. That fuel is oxygen carried by your blood. If your heart's rhythm becomes irregular, if it starts beating too fast, too slow, or just not in a normal rhythm, or if there's a blockage in your arteries blocking the blood flow to your brain can suddenly drop. Imagine the blood supply to your brain suddenly getting turned off, even for just a few seconds. When blood flow to your brain drops suddenly, it can cause dizziness, feeling lightheaded, like you're going to fall over, or even fainting, actually losing consciousness, passing out. That's syncope or fainting. This can happen in an instant. It can come on really fast, often without any warning at all. 1 minute you're fine, the next minute you're on the floor, and fainting can even lead to falls. If you faint and fall, you could get injured. Broken bones, head injuries, it can be serious. While fainting can have many causes, it's true. Sometimes it's just dehydration or low blood sugar or standing up too fast. But when fainting is heart-related, when your heart is the problem, it could be signaling some serious conditions. Conditions like arrhythmia. Arrhythmia means irregular heartbeat, your heart beating in a way that's not normal. Heart valve disease, problems with the valves in your heart that control blood flow, or even an impending heart attack, a heart attack that's about to happen. Fainting can be a sign that something serious is going on with your heart right now. What's the key difference? How do you know if fainting might be heart-related? Here's what Vibrant Seniors wants you to remember. If fainting happens repeatedly, if you faint more than once, or if it keeps happening again and again, if fainting occurs during physical activity, if you faint while you're exercising or even just walking around, or if fainting is accompanied by other symptoms, like chest pain, any kind of pain or pressure in your chest. Palpitations, feeling like your heart is racing or fluttering in your chest, or shortness of breath, feeling like you can't breathe. If fainting happens with any of these things, it's a medical emergency. It's not something to take lightly. It's not just a minor inconvenience. Don't ignore fainting, vibrant seniors. Don't just brush it off as a minor inconvenience. Don't just think it's because you stood up too fast. If you or someone you know experiences sudden, unexplained fainting, especially if it happens repeatedly or with other symptoms, seek medical attention immediately. Don't wait to see if it gets better. Don't wait until your next doctor's appointment. Seek medical attention right now. Call 911 or your local emergency number. Your heart might be struggling. It might be having a serious problem. And catching the problem early, getting it diagnosed and treated quickly, could prevent a life-threatening event. It could save your life. Fainting is not always harmless, especially for vibrant seniors. Take it seriously and get help right away. Number 9 on our list of surprising heart signs: sudden or excessive sweating. Sweating. How can sweating be a sign of heart trouble? It might sound strange, but vibrant seniors, it's true. Breaking out in a sudden sweat when you're in the middle of a workout, when you're exercising hard, or on a really hot day, that's totally normal. That's your body cooling itself down. That's not what we're talking about here. What we're talking about is if you start sweating profusely, sweating really heavily for no clear reason. Even when you're not hot, even when you're not exercising, even while you're just sitting still, relaxing. That kind of sudden, unexplained sweating, that could be a red flag. That could be a warning sign coming from your heart. When your heart is struggling, when it's not working right, it triggers your body's fight-or-flight response. That's your body's natural stress response. It's what happens when you're in danger or under a lot of stress. When this fight-or-flight response gets activated, even if you're not actually in danger, your body releases stress hormones, hormones like adrenaline. And these stress hormones, they can cause excessive sweating. They can make you sweat a lot, even when you're not hot or active. Cold, clammy sweating, sweating that feels cold and your skin feels clammy, not just normal warm sweat, without any exertion, without exercising, especially when this sweating is paired with other symptoms. Pay close attention. If it comes with chest discomfort, any kind of pain, pressure, tightness, or heaviness in your chest, nausea, feeling sick to your stomach, dizziness, feeling lightheaded or unsteady, or shortness of breath, feeling like you can't get enough air. Cold, clammy, unexplained sweating, combined with these other symptoms, can be one of the very first warning signs of a heart attack. It can be your body's way of screaming for help, even if it's not a loud scream. It's a signal you need to recognize. Many people, when they start sweating like this for no reason, they just brush it off. They think, oh, I'm just overheated, even if they're not hot. I'm just anxious, even if they don't feel anxious. Or I'm probably just coming down with something, maybe the flu. They try to find other reasons for it. But vibrant seniors, if you experience sudden, unexplained sweating, especially if it's profuse, really heavy sweating, and particularly if it's happening along with pressure or tightness in your chest, don't wait around. Don't try to figure it out on your own. Seek medical help immediately. Don't delay. Time is critical when it comes to heart attacks. The faster you get help, the better the chances of a good outcome. If something feels off, if you feel like something is not right with your body, trust your instincts, trust that feeling, and call emergency services. Call 911 or your local emergency number right away. Recognizing this symptom early, sudden unexplained sweating, could be the difference between life and death in a heart attack situation. It's that important, vibrant seniors. Don't ignore sudden, unexplained sweating, especially if it comes with chest discomfort or other symptoms. Get help fast. Number 10 on our list of surprising heart signs: unusual or prolonged anxiety. Anxiety, stress. Can that really be a heart symptom? Yes, vibrant seniors, it can be feeling anxious sometimes, feeling worried or stressed before a big event or during stressful moments in life. That's normal. Everyone feels anxious now and then, but what we're talking about here is different. What if you're experiencing sudden, intense anxiety, anxiety that comes on really strong, really fast, for no clear reason, or panic attacks, those sudden overwhelming feelings of fear and dread? Anxiety that's unusual, that's prolonged, that just won't go away. Vibrant seniors, this kind of anxiety, it could be more than just stress or nerves. It could actually be your heart sending you an urgent warning. Your heart and your mind are more connected than you might think. Your heart and your nervous system, they are closely connected. They talk to each other. High blood pressure when your blood pressure is too high for too long. Irregular heart rhythms, arrhythmias, when your heart beats in an abnormal way. And poor circulation when blood flow isn't good. These heart problems can all trigger anxiety-like symptoms. They can make you feel anxious, even if there's nothing in your life that's making you feel particularly stressed or worried. These heart issues can cause symptoms that feel just like anxiety, including a racing heart, feeling like your heart is beating too fast, dizziness, feeling lightheaded or unsteady, and shortness of breath, feeling like you can't breathe deeply enough. In some cases, persistent or unexplained anxiety, anxiety that just won't go away and you can't figure out why you're feeling anxious, may actually be an early sign of heart disease. It could be your heart trying to tell you something is wrong. Many people, and this is especially common in women, mistake heart-related symptoms for panic attacks. They think they're having an anxiety attack when actually it's their heart. Especially women, who often experience anxiety, nausea, and fatigue as early signs of a heart attack. These are not the classic chest pain symptoms that men often get, so it's easy to misinterpret. If your anxiety feels unusually intense, if it happens suddenly, if it comes out of nowhere, or if it's paired with heart palpitations, feeling your heart racing, sweating for no reason, or chest discomfort, any kind of pain or pressure in your chest, don't ignore it. Don't just assume it's just anxiety. Monitor your symptoms closely. Pay attention to how you're feeling. Try to reduce stress in your life. Practice stress-reducing techniques like meditation or deep breathing. These are good for stress anyway, and they can help you calm down and see if your anxiety gets better. But most importantly, vibrant seniors, get a heart checkup. See your doctor and get your heart checked out. Tell your doctor about your anxiety symptoms and tell them you're concerned about your heart. Your body might be warning you about a deeper issue, something more than just stress or anxiety. And catching it early, finding out if there's a heart problem early on, could protect your heart health in the long run. It's better to be safe and get checked. Don't dismiss anxiety, vibrant seniors. It might be more than just in your head. It might be a signal from your heart. Number 11 on our list of surprising heart signs, the last one, decreased tolerance for exercise. This one is about how your body feels when you try to be active. You find yourself getting winded more easily. Winded means getting out of breath, struggling to breathe. Do you get winded more easily during activities that used to feel effortless? Things that used to be easy for you now suddenly feel hard. Maybe climbing stairs leaves you unusually short of breath, really gasping for air. Or a simple walk, just a short walk around the block, feels exhausting, completely draining your energy. If so, vibrant seniors, your heart may be struggling to keep up. Your heart might be having trouble keeping up with the demands of exercise. When the heart weakens, when it gets weaker over time, it loses its ability to pump oxygen-rich blood efficiently. It can't pump blood as strongly as it used to. And when that happens, less oxygen gets to your muscles and organs, especially when you're active and they need more oxygen. This lack of oxygen, this inefficient blood pumping, can lead to fatigue, feeling really tired, dizziness, feeling lightheaded or unsteady, and shortness of breath, feeling winded and struggling to breathe, especially during physical activity. During exercise, or even just normal daily activities like walking or climbing stairs, what might feel like just being out of shape, just getting older and less fit, could actually be a sign of progressive heart disease. It could be an early warning sign of a heart problem that's getting worse over time. Many people, when they start getting tired more easily with exercise, they just ignore these early warnings. They brush it off, assuming they just need to exercise more, that they are just out of shape and need to get back into it, or that aging is to blame, that it's just part of getting older and slowing down. But vibrant seniors, a sudden drop in exercise tolerance, A sudden decrease in how much exercise you can handle is not normal. It's not just aging. It could actually signal heart failure when the heart is weak and can't pump well. Blocked arteries, arteries that are clogged and restricting blood flow, or other cardiovascular conditions, other heart and blood vessel problems. It's not something to ignore. Don't push through the exhaustion, Vibrant Seniors. Don't try to force yourself to exercise when you're feeling unusually weak and winded. If you notice a decline in your stamina, if you can't do as much as you used to, or if you feel unusually weak during routine activities, even just walking around the house, consult a doctor immediately. Get it checked out. Catching heart problems early, finding them when they're just starting, can help prevent serious complications down the road. Complications like heart attacks or strokes. Listen to your body, Vibrant Seniors. It's talking to you. If exercise feels harder than it should, if you're getting winded way too easily, it's time to check on your heart. It's time to see a doctor and make sure everything is okay. Don't ignore a sudden decrease in your exercise tolerance. It could be an important heart sign. Check your heart health. Subscribe to Vibrant Seniors for more and stay vibrant.